Obamacare is dead.
Sort of overarching purpose of the Affordable Care Act was to expand access to affordable health care. There have been these successive waves of attempts to expand access to affordable health care for people, starting with Medicare and then Medicaid. And they've all been controversial because, in part, what these provisions do is they require, some kind of extended role of government and sort of redistributing of resources. This is, another episode where there has been some political opposition to this, because of the, partisan nature of the opposition to the Obama administration, and this is a signature achievement of the Obama administration. There's also some ideological opposition to subsidizing, in part or in full, healthcare for sort of quote unquote, able-bodied, non-elderly, non-infant, non-disabled, but low-income people. And people started talking about protection for pre-existing conditions as an attribute, one of many attributes of the ACA that people actually support very much. And, we do see, people on the Republicans saying, well, we want to protect pre-existing conditions too. Well, saying that's fine, but there's no mechanism that goes with it that would actually provide affordable coverage to people. And there have been some states before the ACA that did have an individual market that required the same kinds of, guaranteed issue and community rating that the ACA requires, but with no subsidies. And, guess what? They had very, very expensive insurance that almost nobody could afford.
The plan will be repeal and replace Obamacare. We're going to have a health care that is far less expensive.
It'll be so good if they end it, because we will come up with a plan, which will be yeah, we will.
But you said it would already.
We have large sections of it already done.
The Republicans have not had a plan. And you can look at a lot of the things that the Trump administration's done. It's been kind of this ground war where there are these attempts to at least hold the line on, if not reduce, enrollment in Medicaid. Even when we had a 3% unemployment rate, we had a creeping uninsurance rate, and it was because people were being sort of discouraged from enrolling in programs like Medicaid. And it's basically been an unwillingness to expand eligibility for subsidized coverage. And that fed resentment of the Affordable Care Act in some ways was that it was felt that it sort of benefited some people, but it didn't benefit other people, and that it maybe made healthcare affordable for some people, but for other people, healthcare was still unaffordable. And I think that's a sort of dynamic that's unique to healthcare. Increasingly, I feel like the public supports the idea that healthcare is a right, that everybody should have access to affordable healthcare, that Medicaid is a good thing. I mean, anytime that there's a ballot initiative to expand Medicaid, it passes. People that oppose the expansion of affordable coverage are, really out of step, increasingly out of step with the public, even in, quote unquote, so-called red states. And you see a place like Oklahoma and you see a place like Missouri just pass Medicaid expansion through ballot initiative. We're in a situation where, there's a public health crisis and an economic crisis at the same time. So it's never been more important for everybody to have access to affordable health care. And I think people are realizing how interdependent everybody's health is.